we're ready to go ahead and get started.
All right. Good afternoon, everyone. Thank you so much for joining us today. My name is Dr. Trina Shanks. I'm Director of Community Engagement here at the University of Michigan School of Social Work. I use she, her, hers pronouns. I'm a person wearing glasses with short curly hair with a purple jumper with a purple shirt underneath. If you want to get closed captioning, hit show subtitle at the bottom of your screen to activate captions. And in the upper right corner, you can toggle between the gallery view or the speaker view. So you could just see the PowerPoint and the person who's talking if that is easier for you to pay attention. We have a great session scheduled for today. We're exploring the history of policing, the disproportionate use of force by police on Black and brown bodies, work that's actually happening to create unarmed crisis response teams in our local community, and the role of social workers in all of this. And as a reminder, students from the Engaged Community mini course, please remember to stay after for a debrief immediately when the session ends. All right, so next slide. I'd like to do a labor and land acknowledgement. Engage is aware that we function in a society that has a deep history of exploitation, stealing both land and labor that has affected and shaped our Indigenous and Black communities for generations. We're committed to acknowledging this in everything we do and to help create a more inclusive tomorrow. So I'll allow you to take a few minutes to read our land and labor acknowledgement. Thank you. I'd now like to introduce the Engage team. So Sonia Harb is a Detroit engagement strategist. Aisha Ghazi Edwin, who helps organize this webinar, is our Engage program manager and also adjunct lecturer. Fatima Salman is our Engage program manager, and Leslie Long is our Engage field intern. And so with that, I'm going to hand it over to Aisha to moderate this session.
Welcome, everyone. Thank you so much for joining us. My name is Aisha Ghazi Edwin. I use the pronouns she, her, and hers. I'm a person with shortish Black hair. I'm wearing a Black blazer that's white checked, and we do that for accessibility purposes so that it's recorded in the transcript. So before we get started, I want to thank former Engage intern Annika Sproul and current intern of Engage Leslie Long for contributing to the research of this session. So to all participants, this is meant to be interactive. We want you to ask questions in the chat. We will unmute you so that you can ask questions directly. And yeah, this is just meant to be conversational. And as Dr. Shanks described, this is a special session exploring overuse of force by police against Black and brown bodies, work that is being done around creating unarmed crisis response teams in our local community, why it's needed. And we also want to discuss the role of social workers in all of this, because I think we often get brought into the conversation and we don't really think about the history of racial discrimination in our own profession and what is a role that we should have in this that centers equity. So I want to go ahead now and introduce our amazing guests. So please join me in welcoming Dr. Daicia Price, University of Michigan School of Social Work Assistant Professor, who's done extensive work around race, policing, and the role of social workers. Dr. Lisa Jackson, Chair of the Ann Arbor Independent Community Police Oversight Commission, local community leader, researcher, and activist around race and policing, and also member of the Coalition for Re-envisioning Our Safety, or CROWS, maybe it's cross. We'll get to how you pronounce it. Donnell Wyche, who is the senior pastor and head of staff at Vineyard Church, Ann Arbor, and also a member of the Coalition for Re-envisioning Our Safety. And Cynthia Harrison. She's a community program manager at the Center for Independent Living in Ann Arbor. She's a community and criminal legal system reform activist, and she's an Ann Arbor City Council member-elect for Ward 1. So welcome, all of you. And now I feel like I've been doing enough talking. I'd like to give you each a few minutes to introduce yourself, your work. There's some prompts on the screen that you'll see. And I ask that you also share your pronouns in addition to your name, some identifiers about what you're wearing just to help make this session more accessible. And I'm also aware that some of you sent some slides in advance that you'd like me to play when you introduce yourself. which I will do. So Dr. Price, why don't we go ahead and start with you?
Everyone, again, Aisha, I feel like you introduced me so well, but my name is Dr. Daicia Price. I do use a pronoun she and her, so that's what I ask people to refer to me as when they're not using my name. I am wearing glasses. I am a dark brown feminine identified person. I have a silver necklace and my braids are in and pulled to the back, and I'm also wearing a headset. As Aisha already said, in addition to being on faculty at University of Michigan, I also work collaboratively with Detroit Wayne Integrated Health Network as a part of their crisis intervention team that focuses on how to support law enforcement and public safety in engaging in crisis situations, specifically focusing on behavioral health needs. And I will just end by saying that the reason why I engaged in this work is not because I had a desire to, it's not that I was like, oh yes, I love law enforcement and I want to see how we can collaborate. It was actually much more, I had a lot of harmful experiences with law enforcement and with myself and my family members. And I decided to think about how I can use my sphere of influence to engage in change. And some of that change has meant engaging with law enforcement in a unique and different way.
Thank you so much, Dr. Price. And yeah, it's about, helping to change these structures that we're all, impacted by. Thanks for sharing. We'll get to more about your work in a little bit. Okay, next up, Dr. Jackson, if you want to go ahead and introduce yourself, and I will also put up your slide.
Okay. So I'm Lisa Jackson. I use she and her pronouns. I have braids also, but mine are hanging down. My hair is brown. I'm wearing a gray dress and a silver necklace. I am the chair of Ann Arbor's Independent Community Police Oversight Commission. I'm also a member of the Coalition for Re-envisioning Our Safety, which we pronounce CROWS. And that was because one of us, was not me, realized that CROWS used to be a symbol during Reconstruction. They were a symbol of abolition. And so we decided that was why we would call ourselves CROWS with that acronym. I was also appointed by Governor Whitmer to sit on the Oversight Commission for the state of Michigan, and that's called MCOLS, the Michigan Commission on Law Enforcement Standards, that does the licensing and unlicensing of all law enforcement personnel in the state of Michigan. And I am a professor of psychology, and my area of expertise is behavioral neuroscience.
Wow, a lot of great knowledge to inform these roles. Thank you. So next up, Donnell, why don't you go ahead and introduce yourself?
Hi, everyone. I'm the Reverend Donnell Wyche. I serve as the senior pastor of the Vineyard Church of Ann Arbor. I am wearing a bright, colorful shirt button down with some white Apple AirPods in my ears with glasses. I have brown, like medium, like chai-ish colored skin with black, short cropped hair. So I have been doing a lot of advocacy in various spaces in and around Ann Arbor. I sort of got my toes into this through the Religious Action for Affordable Housing to start to talk about the issues of affordability in our city. That actually led to me becoming a Ann Arbor City Planning Commissioner. So I sit on the Ann Arbor City Planning Commission. I also do work around affordable housing. So I guess I could consider myself an affordable housing advocate. And so I'm working with a group of organizers through Neighbors for More Neighbors, especially as our community takes up its comprehensive land use process, which is going to get underway in the next 6 to 12 months. I got involved with the coalition Re-envisioning Our Safety by invitation because there were other folks who were sort of interested in figuring out what the city of Ann Arbor was going to do around this program. And so I've been a part, I guess, a founding member of our coalition, and have just learned a lot about the intersections of policing as well as the need for a care-based, life-affirming system. I've tried to be involved in our community in lots of ways. I was a lecturer at WCC for a few years. I also got really involved in just trying to understand those who are houseless in our community. So our church runs a weekly food program at Liberty Plaza every Friday. And then we also participate in the rotating shelter to house some of our unhoused neighbors during the cold winter months. So thanks.
Thank you so much, Donnell. Next up, we have Cynthia Harrison. And Cynthia, here is a slide with just some of the prompts.
All right, thank you. My name is Cynthia Harrison. My pronouns are she, her, hers. I have short, black hair, very short. I'm touching my hair to make sure it's still short. I'm wearing a bluish, light blue gray short sleeve shirt. I'm wearing my signature pearl button earrings that have become signature because I wear them all the time. They work well with many outfits. So brown skin, and I'm really happy to be here today. I didn't really prepare much, but I will talk a little bit about what brings me to this space. You know, well, first of all, I'm a program manager at the Ann Arbor CIL, and that's the Ann Arbor Center for Independent Living. We support individuals that live with a disability. In my spare time, I belong to several organizations or commissions. One is the Criminal Justice Collaborative Council. The other, of course, is ICPOC, where I serve with Chair Jackson, who is here today. I am on the board of Fresh Start Clubhouse, and we are a community designed to support people that live with a mental illness and helping their recovery. I also serve on the board of A Brighter Way, and that is an organization that helps support returning citizens, returning into the community after doing time in prison, and now we are actually supporting individuals that are returning also from jail. I am here in this space. I'm glad to be here, but I kind of was brought to this space as a result of lived experience and the harm that law enforcement has caused. I said I wasn't going to get emotional, to my family.
Thank you, Cynthia.
But that's what harm does though, right? That is
does.
what it does.
I apologize.
No, please don't apologize. It's okay to
Nope.
get emotional. This is, this is trauma.
Yes. As you can see on the slide, I was last year featured in a national article. I was actually one of three main characters, myself, my son, and our local sheriff, Sheriff Clayton. The story was as titled about how a liberal Michigan town is putting mental illness at the center of police reform. That's my son I'm hugging, and he entered into the criminal legal system as a child, and his crime that he was charged of was kicking over a garbage can. So that's how he on-ramped into the criminal legal system, and has, that was many years ago, over 10 years ago. And I like to say, I kind of say he's just as involved, because once you on-ramp into the criminal, let me start my video again, legal system, it's very difficult to get out of it. So I'm newer to the space in terms of the work that I do, but I'm not new to the space I'm not new to the space as a result of living in this space and being supporting the family members that have been harmed. And it affects the entire family, let me tell you, mentally, physically, financially. it causes the amount of harm that is caused, can be caused by law enforcement is it's incredible. And like Dr. Price, that's really, why I'm here. It's important to me now, and it's not important to me now, but now I'm here working against these systems to help repair the harm that it has caused. And I would like to prevent as much harm to as many people as possible going forward. So that's why I'm here, and thank you. And again, sorry, I was really trying hard not to like to lose it up here. But anyway, thank you for being here. And thank you for having me in this space.
Thank you, Cynthia, for joining us. And please don't apologize. I think one thing that's important to acknowledge is this is what racial trauma does, right? In action. And I think that your lived experiences are really important in this space and in your position of leadership, because hopefully you're going to help to change these harmful systems.
Correct. I forgot to mention I'm the Democratic nominee for, as I should mention, for City Council in Ward 1 in the city of Ann Arbor. So that's what brings me here.
Yeah, I'm glad you're in that role. And I should also mention that, this is not going to be an easy discussion. It's probably going to be triggering for lots of people, and it's going to disproportionately harm people, Black people who have joined this call. So I want to name that. So if you need time to pause or step away, please just make sure to, take care of yourself. I want to do a little bit of background, although I'm sure that many of us here understand how policing in America disproportionately impacts Black and brown bodies. But I want to talk a little bit about the origins of policing. So the origins of modern day policing can be traced back to the slave patrol. It was the earliest formal slave patrols were created in the Carolinas in the early 1700s with one mission. It was to establish a system of terror and squash slave uprisings with the capacity to pursue, apprehend, and return runaway slaves to their owners. Tactics included the use of excessive force to control and produce desired slave behavior. That's from the NAACP. So, I want to lead with that because I want us to really ask ourselves throughout this talk, can a corrupt system be reformed? I think that a lot of us know what the answer might be to that question, but it's something that we need to ask ourselves every day, every time that we see a police officer. It doesn't mean that every single one of them have bad intentions, but the origins of that system matter because they've infiltrated how it functions, right? Do any of the panelists want to add any thoughts to that?
I want to add a historical piece because I always think, sometimes I think like an evolutionary psychologist, and I ask the question, if we used to do something a long time ago and we still do it now, what's the function of the thing, right? And so I want to point out that in South Carolina, I believe they ran out of money and they couldn't pay their slave patrols. So you know what they did? They deputized all their citizens to be able to stop any Black person at any time and ask them what they were doing. And so citizens got in the habit of questioning Black people, free, enslaved, whatever, about their business. And so when I see, the term Karen today, I think that looks exactly like what that looked like before. That doesn't come from nowhere. It comes from a history of being empowered to do that, to question the very existence of Black people. And then, of course, that gets extrapolated to other groups of people. So I just want to throw that piece in there, too, because I think it helps sort of people understand that the things we see today are not new. And the things we see today come from somewhere. They don't come out of nowhere. And so I know, if you're 20, you're like, wow. And if you're 40, you might be like, wow, and even 60. But this is, hundreds of years in the making for people to just stop and question as if they have the right to do so. And so I just wanted to add that to that little historical piece, and everyone can ponder whether a corrupt system can be reformed.
That's such an important ad. Right, it's like the empowerment and the supremacy to patrol other people's bodies and to think that you have a right to enforce safety because Black people are unsafe. And also we should name that goes back to this propaganda of society socializing us to believe that Black bodies are more aggressive, more tolerant of pain. are subhuman or unsafe, right? Which is so in line of a country that is committing a genocide. That's what they do. They dehumanize the group.
So much so
the-
that we know people look at African American children, and I don't know the literature on other groups,
Yes.
but they overestimate how old they are. So they'll see a
Yes.
10-year-old boy and think, oh, he's 16 and dangerous. I actually have been a pain researcher by trade for a long time, and it's not so very easy, simple study. They looked at leg fractures across the country, and they just asked the ethnicity, the age of the person, and what they were medicated with. And when they looked at children from age like 10 and under, they saw that across the country, white children were treated with morphine for severe breaks, and African-American children were treated with Advil.
Yeah.
And so disproportionate estimation of the pain and pain management, and just sort of thinking, you guys don't deserve this pain relief. And,
Yeah.
and if you ask for anything stronger, you're drug seeking because you know how Black people are. And sadly, this is still taught in many medical textbooks, that African Americans have thicker skin somehow, and that nerve endings are different, and that we have different pain tolerances. And all of that is based on a study by a slave owner who sliced his slaves open and noticed that they didn't cry as much as he expected. And so he determined that, well, it just doesn't hurt them as much. And something as unscientific, horrific, and psychopathic as that has now become part of the medical literature. And we have to work to eradicate that in med schools. It's astounding.
It's astounding. It's horrifying. And it's also, when you know that someone else experiences pain, I think that's the human connection that gives us empathy. And it allows our society to commit atrocious acts against the Black community, historically and today. Is there anyone else who wants to add to any of that?
I do, and just from a slightly different and personal direction. So my family is from Southampton, Virginia, which is the community that created or birthed the 1831 Nat Turner slave rebellion. And one of the things that I've been studying as I've been studying liberation theology over the last year is just my own sort of story of that. And what that rebellion did was sort of two things, and it sort of ties into the slave patrols, because after the rebellion, a lot of people don't realize it, but the state of Virginia actually considered abolishing the practice of slavery after that rebellion. And because they were concerned about the proportion of Blacks versus whites and just how brutal that rebellion was. There's a fantastic book that came out, I think, last year called Surviving Southampton, African-American Women and Resistance in Nat Turner's Community. So this sort of idea of how they insulated him and protected him while sustaining the community, while the slave owners went on to a rampage to try to crush that rebellion. And to Dr. Jackson's point around the deputizing of their citizens, one of the things that we learn is there weren't enough people to participate in the slave patrols, so they just enabled all whites in the community to take on that role. And as a matter of fact, Virginia, and in particular in Southampton County, they enacted a law that said that any freed African Americans or Africans at that time had to leave the state of Virginia. So because of how they wanted this system to work. And so there's just a lot that we ignore when we come to these systems of policing. Policing is one of these systems that we don't measure on its outcomes. For instance, in the city of Ann Arbor, the deputies within our community have a crime solve rate that's under 20%. Yet we fund it. I know I didn't know the right number, Dr. Jackson, so I didn't want to quote it. I wanted a range so that if someone wanted to fact check me, they wouldn't ignore me because I gave the wrong number. So it's under 20%, but we fund it at 10% of our general fund. So they get over $32 million annually without having to sort of show their effectiveness. It is, as a sense, they are a given in the community. Their position there, and you often find yourself on the other end having to argue, like, well, how does this work? If we only got our trash picked up 10% of the time, or our streets only got plowed 10% of the time, or our elected council members only showed up to meetings 10% of the time, I think there would be different outcomes. But we don't have those kinds of conversations with this institution. And then we believe that this institution is the only way that we can solve our community's problems. And that's a part of something that I've engaged over this last year, what we affectionately call propaganda, where there's just this sort of baseline assumption that this is a net good for our community without any sort of critical analysis of like how it impacts and in some ways how it harms our community.
That's such important points. And it brings me to kind of this next slide, something that you said, everything that you said. This quote really, it hit me that policing in large part for historical reasons has proceeded in kind of a science-free zone, right? It's not questioned. We don't have kind of quality measures that we do for other city services or officials. And considering its roots and considering how we've really brainwashed our society to believe that Black people are more dangerous, we see racism in our police system, right? In our policing, like we see racism in every system. Actually, we have, this quote also struck me. It says, we have a race problem in society that's reflected in policing, right? We have a race problem in society that will be reflected in all of our systems.
So
go ahead, Lisa.
Cynthia and I were just at the National Police Oversight Conference, and the mapping police violence guy was there. And so he had lots of interesting data, and I got a chance to tell him how much I appreciate, his open access to his data. And so now Ann Arbor has police oversight, right? And so we are asking those hard questions of police, but we're doing so in an environment where everyone operates according, that police are great. And so Lisa, really what you're doing is being annoying, and you're just asking them for stuff they don't have. And I've had city council people tell me, you're just asking for too much, when what I'm asking for is transparency. And I want them to show what they're doing and to show how they do what they do. And so very, very simple things we ask for. It takes years to get a hold of. And I barely get to talk about the accountability word, which is when you have officers who are disobeying your own policies, why are they not being disciplined for that? Why are they, in essence, from a psychological standpoint, just being allowed to continue to do that with no consequence whatsoever? And so Ann Arbor is an interesting place because we do not have lots of crime, and yet the solve rate for things like sexual assault is closer to 2%. And so Donnell was being very generous by saying less than 20%, and he's absolutely correct. But in some of those categories, the solve rate is abysmal. And yet people who are victims of those crimes are treated inconsiderately, they're treated condescendingly. And then when they complain about that, there is this assumption that police are just doing their jobs. Now, let me say a piece that a lot of people don't know, which is police actually complain about each other quite a bit in Ann Arbor. And in those complaints, the complaint is often upheld. So when two police officers complain about each other, one of them has to be right. And the rate at which those complaints are believed is far higher than when the exact same complaint is lodged by a complainant. And let me tell you, in Ann Arbor, most complainants are not Black, most are white, and yet they are still not believed. And so what happens to me is sometimes I'll see a complaint and then I'll look at a disciplinary file and see if the officer's done the same thing to another officer, in which case they were disciplined. But in the case where civilian complaints, they're not disciplined. And that's a failure of accountability, but it's also a failure of transparency. Nobody knows that. And so we have to dig that up, and then we have to talk about it, and then people know it. And then what I need is for the community to say, is this reasonable? And so we have to hold police accountable. My little commission can't do that on its own. And so part of our job then is to inform the public and get the public to say, hey, this is not acceptable for policing in our community. But it does also require that we then start thinking about police from a critical thinking point of view. This is the University of Michigan. We are all good critical thinkers here. We're going to ask questions, and we're going to say, if it works in this case, why doesn't it work in another? But we're not used to doing that with policing, to Donnell's point and to your point, and that's a thing that we have to do. I'm a scientist. I look at cells, and so I just have some very basic questions that often cannot be answered by police, and they just look at me and shrug their shoulders, and it's not acceptable. And so what we have to do is sort of let the public know that that's what's going on, because, you know, it's a hot topic for politicians and city council members. You know, they want oversight, but they don't really want oversight. And so we have new council members coming in, different people with different understandings of what expectations should be. And so, you know, I'm more optimistic that council will lean on then police to say, no, let's show what we're doing here. And so, and if what you're doing is fine, then there's no reason not to show it, right? And I think that's like the first step to making police accountable, is just to make them transparent. And that's not going to reform them. I'm not even talking about that. I'm just saying, show what you are doing.
Mm-hmm. Mm-hmm. Mm-hmm.
I want to just jump in a little bit, Dr. Jackson. I love to hear Dr. Jackson talk. So I'm just like, yes, 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 all of the things. I just want to kind of go back to when we talk about this corrupt system, and like Dr. Jackson said, we have to think about what was the purpose of many of the systems that we work in. And most of them were to harm in disproportionate ways specific populations. That's just the bottom line, right? And so when we talk about this, like, should we reform it? Why do we need it? That's the first question we have to ask. And now what people hopefully see with all of us is that we're all kind of doing different yet similar things because the system is still there. So, right, a lot of times people say like, well, let's just end it. Well, okay, are people ready to end it? Are we really ready to end it? Because if we're ready to end it, then we have to change our whole thoughts as a society around, I hear people talking about safety. Let's talk about punitive punishment.
Mm-hmm.
Let's talk about why, if you do feel unsafe, why do you feel like people have to be punished for that? That is a desire to feel like you have a right to be comfortable. Right? If you feel like, oh, nobody can say anything to me, they can't cuss me out, they can't threaten me, who are you? What makes you feel that, and why does it always have to go to, so I need someone with a gun to intervene on my behalf because I don't feel safe? If we want to talk about the problem, we need to talk about that. Because police go into jobs because people call the police. You see what I'm saying? And so when we start to look at the data, and again, sometimes you have to be one of the people that say, okay, let's look at the data. Is it working the way you say you want it to work? Because sometimes it's about getting people, it's basic motivational interviewing, basically, to say, okay, you all say you want to have police because of this. Let's see if that's really working. And if it's not, then you can call people out in ways that are based on science and literature and things like that. But I still believe that there has to be this core fundamental understanding of what are we thinking about when it comes to community safety? And does safety mean no problems, or does safety mean having a mechanism to engage with each other when problems arise? So.
And, you know, this is to your point, Dr. Price, and also Cynthia, to your experience. If we are gonna, I think, rethinking the police system, we also have to acknowledge that, like, we have underfunded so many other essential social services in this nation, like mental health, assistance for poverty, right? And we've used the criminal legal system as a way to punish people who have mental illness, treat people who have mental illness, punish people in poverty. We have to change our thinking, and we also have to change the way we spend money, right? And what we value in terms of people's lives. Can you speak to a little bit, Daicia, about your experience working with, is it Detroit Wayne Integrated Health, and how you've seen the intersection between mental health and policing?
Yeah, so what in our work, and this has been done probably over the past 8 to 10 years, where we've been engaging with law enforcement and all public safety folks, EMS, fire, right? Anyone who will be responding in a 911 call, and started first by helping them to understand not only the mental health that they need, the training that they need to be able to respond to a mental health crisis, but also to be able to recognize their own behavioral health challenges, right? So when we talk about behavioral health and you talk about funding, in my mind, I don't know. I think sometimes people have even messed up what mental health means. People only think about mental illnesses, which means that if you don't have a severe and persistent mental illness, then your behavioral health is not attended to. And we need to have access to support our behavioral health in all the domains of our wellness, right? And so that was the first thing, is recognizing that, one, how can they respond, but also how can they be able to recognize their own challenges that they were experiencing and start getting resources in that way. Then continuing to embrace that, they were like, okay, even with this basic training, we still need another opportunity to kind of think about how do we really connect people to places. And Aisha, I'm gonna say some of it is a funding issue, but some of it is a us issue. And see, this is what y'all hate that y'all invited me here, because one thing that I've learned with working with law enforcement is that social work is just as messed up as they are. Because the bottom line is,
Please talk about Detroit. Remember how we were talking about, you go tell them.
you know, because when we're out there, first of all, can we get out there? So a lot of people want to do co-response and all this kind of stuff. Ask me if we can find anybody to take the position. No, the social worker said, well, I don't want to go without the law enforcement. Well, what you there for then? Because now you already then exasperated the situation by calling the police. So the first thing I learned when engaging with law enforcement, they was like, social workers and behavioral health professionals are always calling us on their client. Now, if people there to get support, you calling the police on them and then wondering why. And then the next time the police come out and somebody's in a mental health crisis, they try to get them connected to services. They say, no, I don't want to work with them. So it's a both and. And again, that goes back to how many social workers on this? It's 94 people in this room. I know at least 60 people scared to walk outside and talk to a person that might have a mental health issue.
So can we talk about who's going into social work, right? And I know some people are focusing on community social work, right? Some people intend to be in the streets working with people, but there are other people who are going to social work, and I hope no one in this room, but with a savior complex. We're going to go save these poor people, right? And so that's problematic, because then if you're afraid of the population of people with whom you're working, of course you're going to call law enforcement. And that is an open conversation that we have had in this county with community mental health workers. That is an open community, Trish Cortez does not hide the facts. She has said in large meetings, she is not sending her people out without law enforcement because she values the safety of her workers. And so what you have is, in many cases, a workforce that is terrified of working with the population whom they're being paid to serve. And there are problems with that as well. And if that's a matter of training, or if that's a matter of self-selection who's going into the profession, that's still going to be a problem for poor people and people of color who become the people of whom their social workers are afraid. And that is part of the problem. And there's been an evolution away from that kind of community social work. I grew up with my dad in the 70s, who was a social worker and ran community mental health in Detroit, and who was out in the streets every day. And that's what his people did. That's what they were expected to do. That's what they came into that job knowing they would do. So they chose that. And we have evolved away from that. And that's not the only solution. This is one of those, I mean, you guys know it's complicated. It's not going to be just the police, just social work, just, anything. It's going to be both and 75 and, right?
Right. And just like Cynthia mentioned, I think what then happens is, even when whatever these social services are, and I guess I've been harmed by law enforcement, and I've also been harmed by social services. So I really am not a fan of any of the things, except for people thinking about what do communities need to be happy, healthy, and safe, and giving the resources to those communities, not other systems, to come in and do whatever we think we doing. That's not it. It has not worked, right? I tell people all the time, if I'm gonna pay social workers to come in too, what I'm paying you for, you half the time scared. I need to get that money to the people that live there. What can they do with that money? Those are things that I think about.
Yeah.
But I'm sorry, I was gonna say what I mentioned, Ms. Harrison. The other piece about that thing, when you have when you're parents of young Black males, and people see your kid as a man, and they're a kid, and they can't engage with them at all, what do we do? right? Because it doesn't matter who's interfacing with them. If they're seeing my son as a man, they're immediately gonna like, my son was a senior in high school. They locked him up as an adult. They said, oh, you can't talk to him. He's a high schooler. And you saying parents don't have a part. Those are the kind of things that end up happening. And we as a community, as a society, we have to take some responsibility for some of those things too. Because again, I look at what is happening. Where's the disconnect? Yes, it's training. Then I think about every single person. I'm gonna probably say it over and over again, because I think every single one of us need to think about, what do we say when we call 911? What do we say?
Right.
Do we say, oh yes, give the police department to the grandmothers? Donnell, we were saying that in that one
Yes.
focus group. I was like, bring my mama and my grandma, and I'm gonna tell you, my mother-in-law will get some people together. Do you hear me? Together. And they don't need no gun to do it.
No.
Right?
And there's
But can I
examples of that
ask a
all over
question?
the world.
Can I ask a question, which is, do you think that that is a function of under-resourcing and having to figure out how to make what works with what you have? And so, like, where my family lived in Washington, D.C., 23rd Street Southeast, it's a high crime environment. I didn't realize it was a high crime environment till I left and looked back in on the community, because my grandmother was sort of an organizer of the block. And so I wonder if this kind of resourcing
Yes.
happens out of necessity, and then there is an empowerment that then springs up around that, and that it's hard to figure out how we institutionalize that, and then how we move that forward, so that there's less community harm. So anyway, it's just a thought as you're talking.
Donnell, as you're talking, the thing that I'm thinking about was yesterday was Black Women Payday, kind of whatever that is, national
Equal pay
awareness of
day.
how Black women get paid less. So I guess if you are a place, I think it's systemic. And I think it was done intentionally in some of our communities. If Black families, if I have to work 3 jobs to make the same amount as a white man, how can I be in a community doing what I can be doing in my community? I have the skills and the services, but if I have to work 3 jobs to be even at a barely making what you making, then how can I protect my kids? How
And
can I do the things I
73%,
need to do?
73% of our families are female headed. So everybody, Donnell, this seems like the perfect time to talk a little bit about like this idea of communities. I mean, so this is part of what has happened with crows. And Donnell, I feel like, is so much more eloquent at this than I am. Thinking
And I just shared the
about,
crows. I just shared the crow slide, by the way. You guys want to jump into this?
I feel like part of it, I'm worried that people are going to think that unarmed response is going to be substitute people with no guns, but just being police with no guns, which is not what it is at all. It's about providing care, but there's also a piece of it about helping communities get the resources to solve their problems on their own because they know it's best for them. Donnell, you do this better than I do.
I don't know about that, Dr. Jackson, but I appreciate it.
It's true.
So I think as I've come into the conversation, the things that I have learned and that I'd like to share is there are resources already embedded within our communities. We don't have mechanisms to activate them and to release that expertise, whether it's because, like was just noted, head of households having to work multiple jobs. My mom, for a period, was a single mom and had to work 2 jobs. She worked at the Department of Interior, and then she worked as a cleaner for the company that cleaned the very office that she worked in. So she would leave her day job, change her outfit into a cleaning outfit, and then clean the very bathrooms that she and her coworkers used. I remember as a kid riding on the bus, the metro with her, carrying trash bags of Tupperware because she had to sell Tupperware or other things to supplement. And so these resources, these problem-solving resources, are already embedded within our community, but they're either not trusted, they're not invested in, or they're not activated to solve some of these problems. And so as the coalition started thinking about how do we approach it, the city has been a great partner and a great dialogue partner as we've had these conversations, but the city's sort of primary reach is an institutional structure. So is this going to be a city department? Is this going to sit within an existing department or a new department? And one of the things that we wanted to do as we started engaging in this conversation is to say, where are the people that already exist within our community? When you're at the farmer's market and someone's having some kind of interaction, there are people who activate like automatically to recognize that something's happening, and then they intervene. As I grew up in the inner city, I had lots of aunts and uncles who knew my movements and told my mom before I could get home about what I was up to, such that she already knew by the time I got home, right? So there were systems of surveillance that were already at work. Now, these were care-based and life-affirming systems because they wanted to make sure I was not up to no good. And so, but that system extends. And often we find ourselves in these conflicts, and these conflicts that we find ourselves in are with our neighbors. And it's like having a property line dispute or trash. Like I was just reading on Nextdoor, for those of you who are brave to be on Nextdoor, about a neighbor who's dropping off their dog's waste in the recycling can. And the neighbor, that's a real situation. I had a neighbor put in cameras to figure out who it was, to track down and then confront those folks. And then people are saying, well, I don't want to have to pick this dog's waste up. And they're like, it's your dog, it's the law. And then that's it. That's the moment where we need someone to help us negotiate, or to de-escalate or to resolve this. And there are people who exist. Like we found out there was a group of women who had been trained in the local prison and released in de-escalation. And it's like, well, what would it look like if we were able to empower them as a part of a unarmed non-police response program, that the skills that they acquired during their incarceration are skills that can be activated to make us safe. And I think—
But Donnell, here got a piece with that. Then they come out and then they can't get hired by the county entities because of their record. Now, what kind of mess is that?
But see, that's why we want to be involved in this program, so that it's not an institutional one that creates that barrier. And we want to say, not only are we willing to hire you, but we're willing to pay you a living wage for Ann Arbor, which means we're going to start at like $30 to $35 or $40 an hour, right? That we are going to recognize that that's what it's going to take to move you from where you were to where you want to be. And working with housing advocates to figure out, well, how do we house folks so that they have housing that once they come out of incarceration into the community, so that they can land in a job and then be able to play that forward. So that's where we sit at the table, right where what you just identified, which is they would be barred from working for a county entity. That's why we want this to be outside of the city, but financially and politically supported by the city, so that we can activate the people that are already present within our community to do what our community is asking, which is for this community safety.
And support does not just mean financial and done also politically, but I need a better word for this, but I want some sort of psychological support. I want some buy-in for the city, because and I'm going to be brutally honest here. The mayor and city council passed a resolution to explore unarmed response, and they did that after consulting with our commission and other public health people in the community, lots of whom may be in this call, but many of whom are in Crows. And so then they explored that, and we pushed that. And one of the things that our commission said, not as a member of Crows, I said, look, that's great. And when we develop an unarmed response plan, it has to reflect what the community wants. So you have to get out, city, and go ask people what they want. And I said it over and over and over and over. And they finally said, we can't do that. So we're gonna have a bid process, and we're gonna hire a company that's gonna go do that. And so there were several bids from this community, with community workers who know this community, who are not afraid of this community, who bid for that. And when they were scored, one of these groups scored higher than all the other groups, and yet they were not hired. The group that was hired was the most expensive, and they are not from here, they're from Lansing. And they have recently, and they have interviewed many people, maybe Donnell, definitely me, and maybe others. And one of the things I said is, how are you going to get out and talk to houseless people? Because I do. I am in the parks talking to people. I'm there in the morning waiting for them to wake up to ask questions about what's going on and what they're experiencing. And if I could do that, you could do that. And how are you doing that? And they said to me straight up, Lisa, we have no plans to go interview individual people. I said, I'm sorry, what? We are going to have focus groups. I said, how are you going to do that? How are you going to talk to people of color? How are you going to talk to immigrants in our community who don't want anything to do with law enforcement? How are you going to do that? You're going to have some Zoom meetings. You're going to have an electronic survey. Are you kidding me? That means the same people who are always involved are going to be involved. And so after, I'm sure some other people echoed my distress, because I said, look, people, you have a job because our commission forced the city to hire somebody because they acknowledge they can't do it. You're not doing any more than what the city could do. And you got paid $99,000 to do this. And so they have reached out to a very trusted community member and said, look, we acknowledge we don't have any people of color in our leadership. We don't have any people of color who work for us. We have no idea how to talk to people of color. We have no idea how to talk to houseless people. We just don't know. Can you help us? So what does that mean? That means that the city overlooked a woman of color local group with deep ties to these communities and decided not to hire them. And they perpetuated, I'm going to say it, a white supremacist model by hiring this very white, expensive company to do the job, and the company is acknowledging they cannot do it. And so what are the results for this survey going to be? They're going to be anybody who could do an electronic survey. Are they going to be people at the Delana Center? Probably not. Are they going to be people sleeping in Wheeler Park? They're not. Are they going to be people, are they going to be substance users? They're not. Are they going to be college students? I don't think so. They had no plans to talk to college students who could definitely use an unarmed response because they're not calling 911 when they're using. Because they're going to get MIP and all kinds of other stuff. And so I want more support from the city than money. I want a commitment to an anti-racist process. That's what I want. And so far, I'm not seeing that. Now, I'm going to be yelling about it and I'm going to be pushing. Cynthia, Aisha, y'all are going to be on there. And I know you guys will be back there too, saying anti-racist, but we can't have white supremacist processes trying to develop a new process that's specifically anti-racist. We can't do that. And yet here we are. And so y'all will hear me yelling about it, but it just can't work that way. You can't develop a process like this and not talk to people directly impacted, most proximate to the violence, most likely to use an unarmed response, people who are sleeping on the streets. Are you kidding me? They're not talking to in the warming centers, Donnell. I mean, it's insane. And they took all this money. The other group asked for half and they scored higher, and yet they weren't chosen.
Right.
That's the end of my TED Talk.
No, I appreciate that, Dr. Jackson. And I did meet with them as well. And I said many of the same things. I was like, are you going to be in Ann Arbor conducting services, surveys? Are you going to go to the farmer's market, go to the library? Are you going to connect? And the thing that was interesting to me was they asked at the end, like, well, who would you recommend that we talk to? And I was like, are you going to pay them? And the conversation just stopped because I was like, well, you're now asking for unpaid labor, but you're getting paid. And it's just, these are the structural things. And Aisha, I feel like we've gotten a little off track for your conversation.
Yeah, I am going to back
pause.
us up. Yeah,
and,
I do
and
want
let you get us back on. But
yeah,
these are some of the structural things that we are facing, even when there are supportive legislative and political structures in place for change. So I'll throw that in.
Thank you. I do want to kind of zoom out a little bit and just talk about why something like unarmed crisis response matters, potentially why it would work, why it's needed. So firstly, I think it's about 20% of calls that come into police are involving mental health illness. Is that correct, Dr. Jackson? I thought that statistic was higher. I also believe like economic crisis, right?
Yeah, it's way higher. It's way higher. It's about 20% are crime based. So you're really looking at 80% that, according to one study, does not actually require an armed response.
Yeah.
And it's something crazy like 67% of people who are killed are experiencing a mental illness, killed by police. I apologize.
Yeah.
So the numbers are insane.
Yeah. And I want to know from, if you guys can back up a little bit and zoom out and just talk a little bit about like, what is unarmed crisis response? What would it look like? I think you guys already kind of clarified that it would not be housed within police departments. I think we also touched on
No.
how social workers as a profession, and thank you, Donnell, for talking about how CROWS is going to use what we are taught as a strength-based perspective, right? Thinking about like being assured that the community in which we exist in has people who can help keep us safe already. We have the knowledge, we have the tools. That's something that social workers are taught to learn as strength-based perspective. So if you could talk a little bit just about the structure of what this would look like, I think that would be helpful.
I think one, it's going to look like whatever the community demands that it looks like, number one. I think the services that could be provided are going to be reflective of what people indicate they want. I'll just throw some things out there, Donnell, you should jump in too. One of those looks like modern drug harm reductionist strategies. Where there are already people in this community who have grants to go out and respond to overdose calls, for example. And that sounds pretty straightforward probably to most of you guys, but I will say that Ann Arbor police have in fact arrested people for carrying naloxone. And they'll say, oh, drug paraphernalia, when that's insane. We should all be carrying naloxone, right? Like everybody. And so probably some drug harm reductionist stuff. Providing a resources to unhoused people who want that. But I think one of the things we think about a lot are things like de-escalation, simple things like noise complaints and neighbor disputes. And can we assist people who are being evicted and maybe have some housing set up, but can't take all their belongings with them, and then they're getting stolen and things like that. And I think a big piece of what we're thinking about is identifying those people in the community and skilling them up so that they can decide on how to solve some of the problems themselves. And there's examples of that all over the place. Some aunties who got together after, in this case, it was just women, but were finding intimate partner violence and their spouses were getting arrested, and which means they couldn't work and support the family. And then they got together and said, you know, police, we're not, and in the state of Michigan, if an intimate partner violence call happens, the police have to arrest someone. So they're going to arrest somebody. And so somebody's going to go through that. But could you instead have a trusted neighborhood person who mediates that, whom we decide we're going to respect these grandmas and whatever they say about the dispute goes? Can we do that? Can we empower people to do that? I know everybody doesn't have a sense of community, and community is hard to define what it is. But I mean, can we work with groups to do that? And I think we can.
Yeah.
Donnell, you got more, I'm sure.
No, I mean, with the menu of services is going to get developed over time, but we want to deal with things like housing instability, medical transport, transportation. We want to deal with drug use and overdose types of things. As Dr. Jackson said, noise complaints, public urination. One thing that's unique in Ann Arbor is drunk students going into the wrong house and being discovered by students. Like, who do you call to sort of resolve that? And quite honestly, when you call 911, they won't actually dispatch an officer to do it. We've heard from landlords who have said, we've called dozens of times and we can't even get someone dispatched, even though Ann Arbor has 126 sworn officers for a city that is producing something like maybe 100 to 120 crimes per month. However you measure crime, that's like the total number. So it's sort of getting into those kinds of things so that the primary number that is called is a number that's a community-based, care-based, life-affirming triage, because that's what it's going to be, right? So someone's going to be at the end of the phone. They're going, like a 911 operator, they're going to listen to what you are calling in for, and then be able to allocate the right resource for that.
So there'll be a different, sorry to interrupt, but there'll be a different phone number than 911.
we want that in Ann Arbor. There's a lot of resistance to that from surprisingly, and I just want to say it that way. Surprisingly, there's a lot of resistance from having a dedicated number, even though in the most generous terms, Ann Arbor already has a non-emergency response number. So it's not that this is new. I just think the thing that I want to say this because I think this is important. The biggest obstacle that we found in all of this work was a lack of imagination. I think that like at the end of a year, and I'll say this, and hopefully this, because this is recorded and I will be quoted. So hopefully how this gets weaponized is okay. I'll just blame Dr. Jackson. No, I'm joking. When we talked to the resolution sponsor said, we had not considered the things that you are proposing. And I thought, I'm just a pastor. This is not my area of expertise. You know, I just care for people on the regular. And I see that there are gaps in our ability to care for people. And I was just surprised and a little disappointed that our political apparatus that has access, our city, the city of Ann Arbor, has a $500 million budget annually. That within that apparatus, there wasn't somebody who was really sitting down in an imaginative space and saying, how can we care best for the community that has entrusted us with this responsibility? And here, this group of 14 activists and, you know, researchers and social workers and organizers and housing folks got together, we got educated, and we wrote a plan. And then when we presented the plan, it was like, oh, that's a really good plan. Like, we should change this, we should change that. And so at the end of the day, what I realized was it is just a lack of imagination, because we're only talking to the same people, which I think Dr. Jackson was getting to. And we're not actually talking to the people who are interacting with those who are in these proximate places of harm. And I think the thing I've been learning is to respond to the question, we're here, why aren't you listening? And so I'm asking myself that question all the time, like, who's not in the room when I'm in the room, to find out whose voice should be there. And so that even that little landlord comment about having drunk college students walk into the wrong house and pass out on the couch, and now you have an undergrad trying to resolve this. Like, how do you get this human being out of your home? And you have a number, and the reason why you call that number is because someone answers. That's the reality, is when you pick up the phone and you dial that number, somebody answers. Well, couldn't we just get another number that somebody answered? And then got you the resource that you need? And then it was like working back from that to say, here's what's possible, here's what's possible, here's what's possible. And I'll drop in the chat a link to the survey that Public Sector Consultants is doing. So if you do live in Ann Arbor or you're a student in Ann Arbor, please fill out the survey and give them feedback, because they do need to hear from more people than the people that they're querying.
Thank you. Thank you for that. And I want to back up a little bit too, and just, you know, I know that not everyone on this call is familiar with Ann Arbor political systems and politics, but for more big picture, is this CROWS model based on anything happening already in the nation? I know a little bit about cahoots.
Absolutely.
Yeah,
Can you all talk
we
about
looked
that?
at every program in the United States. We actually looked at every single one of them.
People. So we didn't just read about them. We went and talked to people. So the oldest one is Cahoots out of Eugene, Oregon. They've been in existence for 40 years, and they have a number of different funding structures. They started out with 2 guys out of a drug rehab clinic in a van, and they just went out and started treating people, and then they started getting calls for more and more people, so it got organically. And then eventually the city sort of took them in, and they are now a part of the city. And one of the things we hear all the time is, well, what if you get in trouble? Won't you call the police? Cahoots calls the police 0.01% of their calls. Do you hear me? Because they hire people who can manage things. There are other places all across the country. And if you go to our website, I'll post the link in the chat in a second. You can see some of the other cities that have already started implementing these cities that are starting to implement it with a number of different funding structures. And so we are not reinventing the wheel. Actually, these things have been done. They've been done for decades. And so they're not new. And Public Health Awakened Michigan actually hosted a forum in summer of 21, I think, where they had people from, I think, San Diego, they had Cahoots. I feel like they had 4 different cities around the country. And one of the things they said that really dispelled a lot of myths was in every city in which they work, law enforcement is happy they're there. They are happy to not take calls about houseless people. They're happy to not take overdose calls anymore. They're happy to not be standing around waiting for 3 hours for community mental health to show up, which happens in Ann Arbor with some regularity, I promise you. You can ask any police officer on the street about that. And so we're not reinventing the wheel. What will be different is that it should be driven by the community. It should be reflective of the community in which the service sits. And so what is important to Ann Arbor is probably different than what's important to Eugene, Oregon, or may not be, but that has to be determined by what's here. So the structures, the way in which things work could vary widely, but none of these models are new. There's a group in Minneapolis called REP. Oh boy. I can't think of what REP stands for, but they determined they're not taking any government money for the first 5 years of their operation. They started very small. They only responded to a very specific number of calls. And then it got a little bigger and a little bigger and a little bigger. And so there are many ways to do this, but none of the things that we're thinking about are new things. So there's 50 different ways to do it. Each of these things have been in practice for some time. Crows would like to be separate from government because we would like to be free of some of the surveillance that government entails. Would we take calls from 911 if they were referred? Absolutely. We know that there are police officers who will have the number on their phones and will call on their cell phone. We have seen this happen in other contexts. So in that way, we cooperate with police? Absolutely. If they feel the call is inappropriate for them and more important for an unarmed response, yes, we would happily take that. But what we know and what is critically important to this work is that we have a separate number, and that when people are calling the number because they expect an unarmed response, that's what they get. So we will not be sending police to those calls.
Right. And then to your question, Aisha, we partner also with the Vera Institute, which is a national organization that's studying this right now. And they've got 2 studies that have come out, one on redefining public safety, which I dropped the link in the chat, but they also have a 911 analysis program where they looked at all the calls to just determine the kinds of work that comes into dispatch. Mm-hmm. So with regard to your question, there have been groups who have started just by listening to the police dispatch band, and they will show up on the scene themselves. They will mobilize themselves and show up on the scene to de-escalate. One program we like to refer to a lot is the one in Albuquerque. They have one where they have behavioralists and sort of de-escalation specialists that are a part of their team. And the NPR podcast 1A did an interview with them. I'll drop the link in the chat, where the person who responds for the team, he just talks about like the difference when he shows up versus when the police show up to the scene, and how easy it is for him to resolve conflicts and issues versus when the police show up. So there are, I would say, like 3 categories. There's the mental health response, which is the one that a lot of people get and understand because we're seeing national coverage of that. So just this month, there was a resident in Colorado who was killed by law enforcement because he was having a mental crisis in his car and got stuck. And when those officers arrived to the scene, they're assessing safety, and the safety that they're assessing is theirs. They're not assessing the safety of the person who called them. And so he couldn't get out of the car, or they couldn't determine what he had in the car. So they used their use of force guidelines, which said They gave a lawful command, he didn't obey it. And so now you're at a new threshold of use of force, and that resulted in this person's death. And what's interesting, and I tend not to try to racialize this as much, but it is wholly racialized, because now his parents are talking about it, right? And they just had a press conference, and they're just like, you know, we were taught to trust the police. We were taught that these are the people that you call when you are in need. And then this happened to our child, because there's this assumption, as you've alluded to, that this happens to a certain population, not to another population. But when it happens to us, it paves the way for it to happen to everybody. And it shouldn't have to come to white folks' door, as it were, before they say, oh, this is interesting. We should be looking at how these police are responding to these situations. Black people have been telling you this for years. And with cameras showing evidence of how these situations resolve. So you have the mental health crisis category, and that's a response. You have sort of the vagrancy one, where it's just like houselessness or public drunkenness or urination, those kinds of calls. And then you just have the public safety responses. That's just a bucket. Like, I think there's a program in Atlanta, as well as the STAR program in Denver. They just have like a multi-purpose SUV, and they have everything in it. They have cigarettes, they have clothes, they've got bus tokens. When they come on the scene, they just sort of open their back truck and try to figure out what's the problem, what's the issue, and do we have it in the truck to try to help you with it. And so our model is hoping to start small. We want to like have a small menu of things. And then as we get the data of what people are calling in our community for, then we want to build the program to respond to the kinds of calls that we're actually going to get.
So thank you. So that was great. And I want to just, you know, for the sake of time and respect everyone's time, we are coming to the close of our session, but I want to give people some chances to ask some questions. So if anyone would like to ask a question, please put it in the chat. And we will,
because I don't think we've said it yet. I do think it's important to name that when we talk about this number, someone put in the chat about 911. Do people call it because it's easier? Yes. If I ask everyone on this call to name the crisis number for your local community mental health, I want to know how many people could name it all. Washtenaw County's you were supposed to be able to access someone 24 hours, 544-3050. In Wayne County, though, it's like really long. It's like 844-2373, or I can't even get it out right. But that's too much when you're in distress, right? And so I wonder how what I'm interested to see is how 988 can be utilized as a tool to fuel people in the right direction. But that's where that political and financial and all of that support has to come in, because if they just send it to the local CMH, that's not doing much. That's not much different than what we already have in place. And so I just wanted to add that in, because everyone's not aware about how 988 is trying to be the new crisis call that's similar to 911. But I think we can, as constituents, put pressure on what is going to happen after that. What is that experience going to be like? Is it going to funnel to local people, or is it going to go elsewhere? And then I also just feel like I just need to say that, yes, everybody is interested in mental health crisis response. I hear that, but like I said earlier, I think if we start thinking about behavioral health in a much different way, when people are activated in different ways, it's still a behavioral health thing. And so whether that shows up like kids fighting or not, it's still behavioral health, because our behavioral health are things that we do, the way that we respond, and our emotions. So if people can't see little Black boys as fighting and little Black girls as fighting as needing behavioral health support, we still messing it up. Because I don't want anybody to leave this moment to still be just like, well, mental health. But, oh, yeah, if somebody is breaking the law, they can be arrested and police should come up. No, if people are not a violent threat to somebody else in that moment, we don't need them.
Also, we should say right now, right here, that in many communities, 988 is authorized to commit people involuntarily to psych eval. And so we have to decide if that's appropriate or not for a community, whether that is well publicized or not. If people call and find distinctions are not made along the spectrum of suicidality, that if they believe the person to be imminently in threat of suicide, they can actually come and send them and be involuntarily committed. And I don't think most people know that.
And then real quick, as you all drop your questions, we also have to pay attention to all of the surveillance on this, because there's a data surveillance aspect of this, and especially with the changing laws around access to reproductive rights, all of that is now in play in ways that it wasn't. So 998 nationwide, it redirects, it first surveils you geo, it finds out where you're calling from, and then it finds the closest mental health number, and then it puts you there. So right to your point, Dr. Price, it's going to put them right back into 911 in that system. So, and people, there's just so much to know about how these systems are not working the way that we want them to.
Thank you. So, I'm going to go ahead and let Heidi Schmitz ask your question.
I put down in the chat, and I know, I'm sorry, I don't want to say your name wrong, Donnell Wyche, put something in there for me, but I asked about how we as community members can get involved in CROS, or how we can contribute so that way we can eventually get some of these needed services to our community members.
Yeah, and my response was just brief. If you sign our petition, that puts you in our email list, and then we send out regular action alerts as well as follow-up steps. And if you are, we've talked with other communities about the work we've done here in Ann Arbor. We're willing to share what we learned to help activate and to get you connected to the right resource. So that's the easiest way to get plugged into what we're doing. And yes, you can sign the petition even if you're not in Ann Arbor or in our county.
The Unarmed response plan is supposed to apply to anyone who lives, works in, and visits Ann Arbor. So, not citizens, residents.
Thank you for that. And does anyone else have another question? And then I know that we're running short on time, so I just want to send a reminder that the students of the engaged community, we're going to stay on quickly with the panelists. I don't see any other questions or comments yet. But thank you, everyone. And thank you to our panelists. This was amazing discussion. And, I want to just turn it back to Trina quickly so she can go over some general information.
Thank you, Aisha. Thank you, panelists. This was an amazing conversation. We've had over 90 people on throughout the time, and most people stayed to the end. So thank you for your time. Thank you for your work. I'd like to at least let you all know what's coming up for Engage. You could get a list of all of our past discussions on our webpage, and it's here. And I think maybe Leslie will put it in the chat. And then if you are in field and you want to get field credit for these sessions, talk to your field faculty to get permission, and that's possible as well. And if you think you're going to come to future sessions, the very next one is on October 20th, Fines and Fees, Punishing the Poor and Increasing Disparity. So talk to your field faculty about getting field credit for that. We also have past sessions you can see online. If you thought this was interesting and want to see what we've done in the past, please do look at that as well. We've had lots of great conversations. But right now, I'd like to thank Pastor Donnell, Daicia, Dr. Daicia Price, Dr. Lisa Jackson, and all of our speakers, and then remind the students and panelists to just stay on for a few minutes. But otherwise, our session is closing unless you have anything else you want to say, Aisha.
No, I think that's it. Thank you so much, everyone, for joining. Again, we're going to send out an email of resources by next week to all participants. And I want to thank all the panelists for their work and their wisdom. And students of engaged community, please stay on just for a few minutes. Thank you all.